COVID-19 symptoms is now down to 17,681. 17,366 people have sadly died in hospital, which is an increase of 852. This number is another salutary lesson, and it tells us of the deadly nature of this virus. We owe it to them and to ourselves not to throw away the progress we've made so far. We have been clear that we will not risk lives by relaxing the social distancing rules before our 5 tests have been met. First, that the NHS can continue to cope. Second, that the operational challenges can be met. Third, that the daily death rate falls sustainably and consistently. Fourth, that the rate of infection is decreasing. And most importantly, that there is no risk of a second peak. I now want to update you on 2 specific areas of huge importance. First, PPE. Protective equipment delivery is an operation of unprecedented scale and complexity. Since the start of the crisis, we've now delivered over 1 billion items of PPE. We're constantly working to improve that delivery system, buying PPE from around the world and working to make more here at home. We have a diverse range of suppliers, and we're working day and night to expand that supply base. We're in direct talks with the factories that actually produce the PPE and the fabric that it's made of. This has proved one of the most fruitful avenues, and I want to especially thank my Foreign Office and DIT colleagues, especially in China, for the incredible work making these connections. I also want to thank the enormous response we've had from our appeal for companies to come forward to help replenish the stocks. As of yesterday, we've had 8,331 offers of PPE equipment, and we're investigating each and every one of those many leads. Now, of course, some of these leads have led to very large-scale purchases of many millions of items. But the reality is that not each of them, not everyone who approaches us can deliver on their offers in scale. I'm very grateful to all those who have come forward, and we are now actively engaged with thousands of these companies. And I can announce that we're working with 159 potential UK manufacturers which are starting to come on stream. I've said many times that I am determined to get people the PPE that they need. This is a 24/7 operation. It's one of the biggest cross-government operations I've ever seen. And I'm grateful to colleagues from the NHS, from Public Health England, the Crown Commercial Service, Cabinet Office, Communities Department, the Ministry of Defence, the Armed Forces, the devolved administrations and the territorial offices, the Business Department, the Treasury, the Foreign Office, and the Department for International Trade for their enormous hard work on this. And I'm also very grateful to Lord Deighton, who delivered the Olympics, for stepping forward to lead this national effort and deliver once again for his country. The second area I want to talk about is vaccines. In the long run, the best way to defeat coronavirus is through a vaccine. After all, this is a new disease. This is uncertain science, but I'm certain that we will throw everything we've got at developing a vaccine. The UK is at the forefront of the global effort. We've put more money than any other country into the global search for a vaccine. And for all the efforts around the world, 2 of the leading vaccine developments are taking place here at home at Oxford and Imperial. Both of these promising projects are making rapid progress, and I've told the scientists leading them that we'll do everything in our power to support. First, I'm today making £22.5 million available to the Imperial project to support their phase 2 clinical trials, which are going to assess a sample of several thousand, and for them to begin the work on subsequently a very large phase 3 trial. Second, I'm today making available £20 million to the Oxford team to fund their clinical trials. The team have accelerated that trials process working with the regulator, the MHRA, who have been absolutely brilliant. And as a result, I can announce that the vaccine from the Oxford project will be trialled in people from this Thursday. In normal times, reaching this stage would take years, and I'm very proud of the work taken so far. At the same time, we'll invest in manufacturing capability so that if either of these vaccines safely works, then we can make it available for the British people as soon as humanly possible. Nothing about this process is certain. Vaccine development is a process of trial and error and trial again. That's the nature of how vaccines are developed. But I told Sarah Gilbert and Robin Shattuck, two of our most inspiring scientists, that we are going to back them to the hilt and give them every resource that they need to get the best possible chance of success as soon as possible. After all, the upside of being the first country in the world to develop a successful vaccine is so huge that I am throwing everything at it. Coronavirus is a powerful enemy, but I believe that the power of human ingenuity is stronger. Every day the science gets better, and we gather more information and we understand more about how to defeat the virus. But in the meantime, there's one thing that you can do, and that is to stay at home, to protect the NHS and save lives. Thank you very much. I'm now going to ask Professor Van Tam to take us through the daily statistics.
Thank you, Secretary of State. I'll begin with a slide that you've seen many times before. I don't apologise for showing it again. It is important that we continue to monitor the extent to which the British people are following the social distancing advice and, in this case, referring to the slide, not travelling. And you can see a range of indicators there from all private motor vehicles through buses and tubes in London, through to buses and national rail in the whole of the UK. And you can see a very clear prolongation of these low trends of usage compared to where we were in the middle of March. This is a good sign. It shows that we are continuing to follow the advice given to us by the government, and that in doing so we will get on top of the current wave of the coronavirus threat, and we will begin to turn the curve. Next slide, please. This next slide, again, you have seen before, shows the new cases diagnosed in the UK. The dates along the bottom of the slide refer to when the lab tests for that individual were completed. And you can see, of course, that there is some day-to-day variation, but the numbers remain high, and it isn't clear that there is an enormous downturn at this point. So the numbers are varying day to day, but they remain high, and we remain in a situation of danger that we must take very seriously indeed. You will see, as the slide progresses from left to right, the proportion of orange beginning to show greater and greater. This is a distinction between the NHS and Public Health England capacity and testing in blue, and the coming on stream of commercial testing to supplement that as time goes by across the slide. Next slide, please. Now, this is a very important slide, and of course refers to people, the total number of people